2010 is probably the biggest year for health IT there's ever been, in that the proposed rule for meaningful use came out just before the beginning of the year. And so the proposed rule for meaningful use was out until July 13th and received thousands of comments to CMS on that rule. And then the final rule was released on July 13th. So that entire process was a really, really big deal in health information technology. Now, at the same time that was going on, they were developing the standards and certification criteria for vendors to be able to have certified electronic health record systems, which is, you have to be a meaningful user of a certified electronic health record to receive incentive payments under the program. And so the certification rules that came out, the companion rule with the meaningful use definition, was another really important thing. Shortly after that, now this year just gets bigger and bigger, was the announcement of the temporary certification bodies. So CCHIT, Drummond Group, and others, there's 5 now, are temporarily authorized to certify electronic health record systems. And so then they created a website called the Chapel. It's CHPL, the Certified Health IT Product List. You can go to the ONC website and go to the Chapel. This is another thing. Over 2010, if you go back to the Internet Archive and use the Wayback Machine and go back in time to look at the HHS.gov Health IT, where the ONC website from January of this year to now, it has really grown exponentially, and it's a very useful tool. So that's another big deal that's just been kind of evolutionary throughout this year. And the Direct project was started in March of this year and has been just incredible in the amount of collaboration and in the work that's being done on getting simple messaging of health information flowing between providers.
And here we're talking about NHIN Direct, is that right?
Yeah, it used to be called NHIN Direct, and there turned out to be some stupid trademark issues with the NHIN. So the National Health Information Network has become the Nationwide Health Information Network. NHIN Direct has become the Direct project, and there's still HHS. It takes a little while for the government to pivot, but they're going to be doing a rebranding effort on that whole federal health architecture, really, of how the health internet, what I call the health internet, borrowing that from Wes Reichel and others who have kind of coined that term of the health internet being the exchange of electronic health information using internet protocols to safely and securely exchange clinical information between care providers. I think so. One of the biggest things of the year is what just happened, and it's going to probably have reverberations over the coming months and years in health IT, and that's the President's Council of Advisors on Science and Technology, the PCAST, came out with a report on health information technology to the President. And everybody is so focused right now on what CMS and the Office of National Coordinator are doing that not a lot of people, I think, are realizing the significance of this report to the President, which at the last Health IT Policy Committee meeting, the National Coordinator for Health Information Technology, Dr. Blumenthal, told the Federal Advisory Committee that the President strongly supports this report and we need to take another look at things. This is really going to have a huge impact on health IT and the future shaping of policy and the direction that we go in this country. So I think probably the biggest thing of the year for health IT is the thing that people haven't really had a chance to digest yet, and that's the PCAST report to the President. They talk about creation of a universal exchange language that'll enable healthcare providers to share information in real time, and a digital infrastructure for locating patient records while still providing patient privacy and security. They're talking about using a type of XML and open standards for the development of this new language for health IT. Well, in 2011, you can be sure that most people will be trying to get to the point where they can receive some incentive dollars, and it's 2012 as well. So I don't think we're going to see the massive paradigm shift in workflow and in technology over the next year to year and a half. But after that, so if we take the longer view and we look at 2, 3, and 5 years out, there's a lot of things I think that are going to make a big difference. One of them being mobile, right? So I notice when there's a whole younger generation of physicians out there, and they're armed with an iPhone at their hip, and they want to be able to access their electronic health record system or send a prescription electronically or send information to their patient or communicate with their staff and their colleagues using their mobile device. That's what they're used to, and they're able to do that in other parts of their life, but they're not able to do that in their professional life. And eventually, I think we'll see a whole host. There's already quite a few of them out there of medical applications for smartphones. You're going to see a lot more of that, I think. And mobile will become a very important part of healthcare over the coming years. I think that that's paramount, is the privacy and security concerns. And whether it's with a mobile device, whether it's over a 4G wireless network or your own internal Wi-Fi or your Ethernet, or however you're moving health information internally within your organization, and then certainly when you get out into the wilds and you're exchanging between organizations. But I think that the solutions are there. I think this is a great opportunity for folks out there that, if you're into the security industry, the technology security industry right now, healthcare is a great place to be because that's going to be a concern that just continues to need to be looked at. One of the things that is going to really be worked on hard in 2011 in preparation for everything else we've been talking about. I know that they've had a couple of meetings just this month on patient identity and on provider directories. So, in order for me to be able to send electronically what I'm doing right now on a fax machine, on my fax machine I've got a speed dial and it sends it right to the pharmacy. And I hit the button and I'm sending it over to the pharmacy. I have their phone number. If they change their number, they let me know, and I manually change it in my fax machine, right? Well, now we're going to have this national network, and everybody needs an address, the @ sign for the health internet. And we need to be able to identify people. As you say, the actors, both patients and providers and organizations, have to be identified. And a big part of security is identity management. So I think that that's another area, along with privacy and security, where there's huge opportunity because we haven't solved those problems yet. And, I think there's potential for, over the next few years, for some people to make a lot of money coming up with creative solutions for the problems that we've outlined. So they have a privacy and security tiger team that they've created as part of the Health IT Policy Committee. And on the 9th of this month, they had an all-day meeting in Washington, D.C., the Privacy and Security Tiger Team, a public hearing on their on this issue, on identity management. And so if you go to their website and you drill down and you get to the Privacy and Security Team and you see, the Thursday, December 9th meeting, there's the meeting audio there from, all 8.5 hours of this meeting, and then also all the bios of the participants and all of the documentation that they used during the meeting to have this important discussion about basically the identity crisis that's going on in healthcare. And so that was a very important meeting. I think there's going to be some other milestones coming up in 2011 around identity management. They also have a provider directory task force that's working within the information exchange work group that's been working on managing the identity of providers. So initially, with the Direct project and other work that's going on, we're talking about exchanging information between care providers to provide better care coordination. So I send a referral to a specialist. I send along clinical information about the patient and specialist needs to be able to see the patient. They send their consult notes back to me, all digitally from his electronic health record system to mine, and we are better able to coordinate the care of this patient, improve the quality of care, and lower the cost of care for this patient. We also want to get patients involved in their own care and ultimately link patients into this system, this health internet. So there's personal health record products out there. Google has Google Health. Microsoft has the Health Vault product, and there's others that patients can use to participate in their own health care. And so the identity management is important from a perspective of I need to be able to make sure that the record that I'm importing is actually Dazza and goes into your medical record and not into someone else named Dazza, if there is one. So identity management is important for not only the patients, but the providers and the entities that are exchanging information. And I think you're going to see a lot of opportunity and a lot of discussion around how best to solve that in 2011. Well, so at the Office of National Coordinator, they have two federal advisory committees, or FACAs, F-A-C-As they call them, and then a number of work groups within those committees. One is the Health IT Policy Committee that meets monthly, and the other is the Health IT Standards Committee that meets monthly. And so, as I said, they have a number of work groups within those. And if you go to it's healthit.hhs.gov. And if you go to that website and you look and you see their federal advisory committees, and they list all of their meetings. All their meetings are streamed on the web. They're webcast. The next day they've got their minutes up. They've got the audio from the meeting up. They've got all the PowerPoints and the meeting materials that they have available. They're totally open and transparent process. So and they invite public comment, and they seek out public comment. They really want stakeholders engaged in the process of how they're doing this. Well, the easiest way, I think, is just Google my name, Ahier, and you'll find me on Twitter and my blog. I blog on O'Reilly Radar as well, and some other places I'll guest blog occasionally. And then ahier.blogspot.com is my personal blog. And then there's ahier.net, which I use just kind of using Posterous just to aggregate interesting things I find on the internet. And I link most of that through my Twitter account. So twitter.com/Ahier. And, if you follow that feed, you can be sure to catch at least most of the things that I find interesting.